Okay, so when you hear the word migraine, what comes to mind? Just a really bad headache, right? Well, it's so much more than that. It's a seriously disabling neurological disorder. And here's the crazy part. What if I told you the biggest problem we have in treating it isn't about finding some new miracle cure? It's actually a massive failure to use the solutions we already have. So let's get into it. Let's just start with a number. A really, really big number. 111 billion euros. That's not a typo. That's the estimated cost, both direct and indirect, of migraine in the European Union every single year. So you can see right away, we're not just talking about personal suffering here. This is a huge economic problem. Okay, so with a problem that costs that much, you'd think people would be rushing to their doctors for help, and you'd be right. They are. But that's where things get weird. We run into this strange paradox where patients are doing exactly what they're supposed to do, but the system is failing them, big time. Just take a look at this. This data comes from a German study with almost 2,000 patients, and it's pretty eye-opening. Almost 90%, 89.5% to be exact, had seen their general doctor for their migraine in the last year, and nearly 75% had seen a neurologist. I mean, these are the exact people they should be seeing. They are doing everything right. So this is the big question, isn't it? If pretty much everyone is going to see the right doctor, then what on earth is the problem? Where is this whole thing breaking down? The answer, it turns out, is something called the treatment gap. And again, this has nothing to do with not having fancy new drugs. It comes down to a really basic and honestly a preventable failure. A failure to stop the attacks before they even start. And if you want to see just how big this gap is, look at this. In that same study, over half, 53.3% of all patients who showed up at a specialized headache clinic had never, not once, been prescribed a preventative treatment. Just let that sink in for a second. These people made it all the way to a specialist, and nobody had ever offered them one of the most basic first-line defenses against migraine. Now, you might be thinking, okay, well, maybe those patients just had mild migraines. Maybe they didn't really need it. Nope, not at all. Of that group that never got a preventative, more than 60% of them absolutely qualified for it. We're talking people who had 3 or more migraine attacks every single month. They needed this treatment. And this isn't just some abstract number on a chart. This has very real consequences. On average, these untreated patients missed 5.1 days of work or school in just a 3-month period. That's not a tiny little oversight. That is a massive failure with real-world costs, both for the person and for the economy. But wait, there's more. The problem isn't just about not getting preventative care. There's another layer to this, and it's just as serious. It's about using the wrong kind of treatment when an attack actually happens, and that can lead to a really vicious cycle. And this is happening all over. Take this data from a big study in Poland, for example. Almost 23% of patients are using their acute meds so often that it's putting them at risk for something called medication overuse headache. Yeah, you heard that right. The very thing they're taking to stop the headaches starts causing more headaches. This happens a lot with these combination pain relievers. And in a place like Poland, a lot of the popular over-the-counter stuff has codeine in it, which is a huge driver of this problem. Now, here's where it gets even more interesting. These big systemic problems, well, they don't hit everyone the same way. When you start to look at the data through the lens of gender, some really surprising, almost counterintuitive patterns start to pop up. So back to that Polish study. It turns out men were actually less likely to be on preventative treatments and more likely to be relying on those acute meds. And what does that lead to? Yep, a higher rate of medication overuse. But here's the real head-scratcher. Even though their treatment habits were riskier, men actually reported less disability from their migraines than women did. So you've got this really complex mix of treatment behavior and how people perceive their own condition. Okay, so let's recap. We've got undertreatment, we've got the wrong treatment, and we've got all these complex patient factors. It sounds like a total mess, right? Almost impossible to solve. But the solution is actually way simpler than you'd think. It's really just about following a blueprint that we already have. And honestly, this is the best part of this whole story. We don't need to sit around waiting for some scientist to invent a miracle drug. The solution is already here. It's written down clear as day in established, evidence-based treatment guidelines that doctors all over the world have access to. And we know for a fact that it works. Let's go back to that German study one last time. They actually followed up with the patients after they started them on proper guideline-based care. And the result? Over 71% of them rated their therapy success as very good or good. It's that simple. When you just follow the playbook, patients get better. It's a direct cause and effect. And that brings us to the final, really challenging thought. And this is a direct quote from the researchers who did this work. We know the cost is enormous. We know patients are doing their part in asking for help, and we know what the solution is. So the real billion-euro question isn't what should we do, it's why aren't we doing it?